Did you know that you're supposed to live 120 years? Yet most people in the U.S. die in their 60s, 70s, and 80s. Welcome to Longevity with Dr. Wilcox. For the next 60 minutes, we're going to add years to your life. The phone lines are open at 731-1230. That's 731-1230. Or toll free. 1-866-820-5528. That's 1-866-820-KLAV. Now, let's bring on the host. Here is Dr. Simmon Wilcox.
Good morning. Glad you're with us today. We're gonna look at this subject of I think I've entitled it, "Don't Let Your History Impact Your Future." Don't let your history impact your future.
I like that, Doc. What does that mean exactly?
Yeah,
I know about the past affecting your future and trying to hold that back, but we are talking about our bodies today.
Yeah, I know it's a little confusing, JR. I changed the script on the way over here, and I didn't tell you. So,
no, you didn't.
So you're looking at
since we drove separately.
We normally drive together. I'm really talking about the adrenals.
Okay.
You know, don't let your history impact your future.
You know, I've heard of the adrenals. I know a little bit, but nothing about them. Tell me about adrenals, Doc. What are they?
What I'm trying to bring home is that those who have a history of trauma, emotional trauma, physical trauma, significant deaths of individuals who they were tied to 15, 20, 30 years ago.
Wow.
Problematic divorces, death of a child, severe illnesses, stress. All these are stresses. Stresses that you've endured in the past, even in the past, not just last week, but last year, last decade. Those stresses particularly those stresses that linger with you, linger often on an emotional level, and sometimes we've tucked them away. They're in the closet. They're on the shelf, and we don't actively recognize them emotionally, but they're there. They cause this ongoing stress and release of hormones from the adrenal gland, and your adrenal glands actually become fatigued.
Wow.
And it's a different level of science than what we've talked about up to now. We've talked about minerals, and we've talked about vitamins, and we've talked about alkaline water, and we've talked about 3 bowel movements a day. We've talked about all that kinds of stuff. But one of the things, and it came to mind because one of the clients this weekend who was treating, who happened to be overweight.
Right.
And as I talked to this particular individual, it became apparent that she didn't overeat, but she was overweight. And I've said this before, everyone who is overweight does not overeat. It became apparent that there was issues that had occurred 15 years prior to arrival to my office, our office on Saturday, that things had occurred and at a time when she wasn't overweight. And then from that point on, it appears that the weight has packed on. And not to diverge, but weight is a funny thing because fat cells, as you increase the number of fat cells you have in your body, they multiply. As you lose the weight, the fat cells actually don't disappear. They shrink. So you lose the weight, but every time you add on fat cells, you got them for life. And so now you have to micromanage it like another organ because fat behaves like an organ. And when it starts to behave like an organ, it releases certain fatty acids as opposed to it's there for energy. But when you have excess resources in terms of fatty energy resources, we have excess fat cells, it then becomes a toxin. And that toxin further compromises you in terms of your ability to lose weight. So that's how it came up this weekend. But reality is that individuals have had traumatic experiences that they have not dealt with. Have not dealt with emotionally, have not talked through, have not done the appropriate releases that need to occur, are still harboring anger and resentment and pain. And even though we see that as more of a psychosocial, emotional item, the reality is that our bodies are structured in a way that our adrenals picks it up. And when our adrenals pick that up, it begins to continue to turn out excessive amount of hormones to the point where it becomes fatigue. And then you need to find a doctor who understands the adrenal fatigue process to begin to begin to address those particular concerns.
So how do you treat the adrenal fatigue, Doc? I mean, it sounds like it's pretty complicated, tied psychologically to past issues, but how do you treat it?
Well, and before I go there, maybe I should just identify where that adrenal is actually located. The adrenals is a small grape-size organ that resides on the top of your kidney. The strange thing about it is that as small as it is, it's critical for something we call the hypopituitary axis. It's critical because it actually manufactures about 50 different hormones in your body.
Wow.
50 different hormones in your body in 3 different major systems. So it's critical for quality of life. It's critical at the end of the day for life.
Yeah.
50 different hormones in your body the adrenals will regulate and produce. Now you come with what seems to be a non-medical event, something that happens at home or on the highway with an accident or in your life that's traumatic, that's stressful, and you take this grape-sized organ and you put it on overload. And in putting it on overload, then all kinds of things start to become awry. So it's located there on top of the kidneys. The answer to how to retreat it is that, and we've talked about this before, intravenous glutathione.
Okay.
Because the glutathione becomes markedly reduced as a result of that. The intravenous omegas we talked about before that we do in the office, in terms of trying to address it and restructure it and re-energize it, to bring it back to its baseline functioning status. There are a number of other things. You got to have your vitamin D3, and we've talked about vitamin D3 before, but it's critical here.
Yes, we have.
You need to have your vitamin C on board in high dosages to attempt to correct the problems with the adrenals. We have to again modify our diet in a way we've talked about before, in a healthy way, so that we don't beat up the adrenals with excess sugars being on board. As most of us have heard of cortisol, and cortisol is one of those items and one of those hormones that the adrenal gland is critical for, and so that we need to be able to have that cortisol regulation return back to what we feel would be normal.
Okay.
Yeah.
Wow. As I vision this as being a layman, I just took it's like a battle in there, isn't it? I mean, this thing's the size of a grape, but all these other things are trying to attack it mentally, physically, and what's inside your body. But it needs some help. It needs some shields. It needs some cleansing. It needs some troops. It needs it needs some pals to help it out. And it's just it's a battle inside the body. It sounds like
it's a war. It's a true chemical/emotional war. It's where your emotions kind of marry and meet the chemicals, and you have to micromanage that the way you manage other things in one's life. I weigh 260 pounds, but I have this one item the size of a grape. And weight maybe it weighs 7, 8, 9 ounces, and that item is critical to my well-being, to my quality of life, to my longevity. And so that we really sometimes underestimate. We think about the big things, the liver, the kidney, the heart, the brain, the lungs, and we forget about the small items. And the small items we often forget about is the adrenal, because it is critical. It is extremely critical.
It's there's no way to go. I mean, it's not beyond repair at any time, is it?
Well, it's not beyond repair, but it's just a matter of how do you repair it. So one has to try to figure out and find a physician who understands adrenal syndrome in order to get it repaired.
Let me ask you this: if I wanted to measure such things as how my adrenal gland's performing or not performing, is there a blood test for this, or how do you know?
Well, that's part of the difficulty with the adrenal gland. When you have excess hormones or low hormones, say cortisol, we measure the cortisol. Then we come up with certain diagnoses, whether it's Addison syndrome, etc. But when the adrenal gland in the face of chronic stress, your test will just come in as like low normal, and often people will write that off as everything's okay, just low normal, and walk away from that. But the low normal in the face of someone who can't lose weight, the face of someone who's overweight and is not overeating, in the face of someone who's having difficulty sleeping, in the face of someone who is having palpitations. And one of the things I do often when I'm talking to my patients, I say, let me just hold your hand for a second. And if in my mind I'm thinking about the adrenal cortisol syndrome, the adrenal fatigue syndrome, I take the pulse. And often the pulse will be rapid. The pulse will be 110, 120, and our resting pulse should not be 110, 120. Now there's some other medical issues as why you may have a rapid pulse, but as a rule, one who's healthy or one who's just only has hypertension or only has diabetes should have a normal pulse. If your pulse is accelerated, that's my first clue there may be a problem. I need to go look at your adrenals. So if your resting pulse is 105, your resting pulse 110, and there's something called the heart rate variability machine that we're getting in the office here,
right?
In the next 10 days or so, that serves to document this rapid pulse that's there. So one of the things that clues me in is that your pulse is rapid, even when all your blood tests appear to be normal. If your pulse is rapid, then
you have another clue. And it's just like the young lady that came to the office, and she, as we talked more with her and you spoke with her, she did have a traumatic thing happen in her life. She lost her brother to addiction, and she was overweight, and she said she couldn't lose the weight even though she would cut back on her eating. So there's two big clues, as what I'm understanding, if I'm reading that right. Mm-hmm. And then the rest of the tests.
Exactly, and different people have different issues that serve as clues. So, first of all, the practitioner has to be mindful that there may be a problem.
Yeah,
and so it has to come to your forefront because it's not a clear blood test that gives us an answer.
But all the good times we get to spend with our docs, all that long time, that 3 to 5 minutes. Don't get me started.
Yeah, don't get JL started on physicians. Let's take a break. You listen to KLEV 1230 AM, KLEV 1230 AM. Please give us a call, 731-1230, 731-1230.
We'll be right back.
Are you having difficulty detoxing from drugs or medication? Let Dr. Wilcox help you. Call at 702-749-7111. His revolutionary detoxing program is designed to help you detox without the discomfort of other procedures. Call him at 702-749-7111. Visit his office in Summerlin at 8751 Charleston, Suite 210 behind Fleming Steakhouse. Call Dr. Wilcox at 702-749-7111.
Just about 4 years ago, I was longboarding, hit the side of a truck. I'm sent home with the oxycodone and the Percocet. The dose milligram, it didn't change, but How often I would take them? Did. I wanted to stop. These withdrawal symptoms are something that I wish upon no one. I went to my doctor, Dr. Wilcox. He claimed withdrawal free. It was literally a miracle. I feel, I would say 100% better.
I'm Dr. Simmon Wilcox. I've been practicing medicine for the last 23 years. My passion has been drug and alcohol dependency, particularly methamphetamine. So what I've done in my practice, I've re-engineered how we approach the detox rejuvenation process. You go through a process where you don't feel any symptoms. My staff's priority is to ensure you're not having that discomfort.
Call 702-749-7111.
Do you know that 60% of the healthcare dollars spent over the next 10 years will be spent on stem cells or a stem cell related process? Listen in as we define for you how medicine will change your life and the life of those who you love over the next 10 to 15 years.
Covering the issues that matter and adding years to your life. Longevity with Dr. Wilcox. Monday and Thursday morning at 10. Only here on KLAV.
Hello, my name is Dr. Simmon Wilcox. I'm a board-certified physician in family medicine. I have 20 years experience with drug and alcohol abuse and treatment thereof. I bring to you a new service at my facility. We're asking you to examine your household, your family, your community, and decide if there's someone there who needs what we have to offer.
Give Dr. Simmon Wilcox a call today at 702-749-7111.
Longevity with Dr. Wilcox continues. Here again, your host, Dr. Simmon Wilcox.
We're back. During the break, we had a caller. The caller's still on hold. Tiffany, are you there?
Yes, I am.
Hello, Tiffany. Let me just prep this for 1 second. Let me let you know this is Tiffany. She ranged from California.
Tehachapi,
California, and she learned about us and through one of her girlfriends or boyfriends, I'm not sure who, and made her way down to Vegas, and we had the opportunity to treat Tiffany without telling all of her history that she had issues, and we met her and she was busy because she's out making some deals and working on building some new nursing homes actually, and we actually had to visit her in her hotel room and gave her a treatment. Tiffany, can you just tell a little bit about how you was feeling before the treatment?
Mostly how I was feeling before the treatment is always tired, fatigued, don't really have the energy. My symptoms go back to almost 11 years from my second child. Okay. And so I've had, 2 treatments now? Yes. And it's been an amazing journey how I almost feel like I know my name again.
No, but you called me, and I was in the middle of treating somebody on Saturday, and you said you walked into the beauty salon, and what did the lady say to you?
Well, the beauty salon, it's in Valencia, and Kathy has been my hairdresser and my boys, but she's known me for 25 years. Uh-huh. And then I had 2 other clients that happened to be there at the same time, along with 2 other people that are cutting hair. And I walked in, and they were like, wow, what have you been doing? And I said, well, I've actually been taking good care of myself, and I hooked up with a doctor that listened to me and gave me a couple treatments that make me feel like I'm back on track again. And they said my skin and my hair, and they thought that I, basically looked 10 years younger.
We get that often, and I haven't said this before, but probably because I've forgotten to say it, but that when you receive the intravenous glutathione, which is what you receive, and intravenous omegas, which is also what you receive, along with the Myers cocktail and the vitamin B12, those 4 items what you receive, B12 injection, glutathione injection, omega-3 injection, and the Myers cocktail IV. First of all, Tiffany, was it painful?
No, not at all.
Okay, so some people are very nervous about the thought of needles and painful. So there's one needle, which is just a butterfly, And once you put the butterfly in, then we begin to give you all the other medications through the one butterfly. How long did the treatment take, Tiffany?
I think about 20 minutes.
Okay.
That's because we're chatting, but
Yeah.
Maximum 20 minutes. Maybe?
Yeah, 20 minutes. And that's usually 20 to 30 minutes, depending on exactly how fast or what size vein we actually find and put it in, et cetera, et cetera. And then how long after the treatment did you feel a difference?
My first treatment, instantly, I felt like my body was detoxing, and it was getting rid of a lot of things that it seemed that was in my body.
I think you told me.
And then, yeah.
Yeah,
you want me to say it?
Yeah, you can say it. You can say it. Go ahead, say it.
Okay. Yeah, believe it or not, I had to go to the restroom every hour. I was in the bathroom.
You're urinating every hour. Yeah.
I was like, and I did it for almost, I know this sounds silly, but it was 7 hours. I was like, whoa, what is in my system? And I joked about it because I just came back from Costa Rica.
Uh-huh.
And so anyways, the next day I started feeling really good, and I thought, wow, now this is interesting. I have a lot of energy. By the third day, I was like, okay, I need to make another appointment. I'm ready to go see Dr. Wilcox again.
Mm-hmm.
And I couldn't wait because like I said, I haven't felt this good since, my pregnancy. And most of the time it was, I don't know, it's been amazing. And then the second treatment was last week, and instantly within an hour I started feeling good. The next day I had more energy than I knew what to do with. But more important than the energy, I had the clarity that I was very clear on everything I was doing, and everything was a lot more calmer to me of what was really going on in business and personal, my 2 children. So, it's really exciting to know that something as simple as this, that somebody finally listened and I could actually get treatment and start feeling good again.
Tiffany, thank you for calling. I know you're busy. I know you're a lady who's in the process of building both medical retreats and nursing homes in Costa Rica, as well as the ones you own there in Tehachapi, as well as the one you're building here in Las Vegas. So thank you for taking time out of your busy schedule and calling in to chat with us. Thank you much.
Yeah, thank you.
Take care, Jeff.
Sure.
Bye-bye.
Bye.
Take care.
Hey, Doc, good question that she kind of came up with, and the question I have in my mind is, how long does the treatment last?
And that's the interesting question. And I tell people it kind of depends on what you're asking about. The sense of well-being, the sense of energy that people consistently talk about, they usually feel that within the first 24 hours. I tell them it doesn't take. Don't call me back in 2 or 3 weeks. Call me back. I give most people, as you know, my cell phone. Text me back the next day and tell me how you feel in the morning. That's how quick it's going to work. Some people, it's almost working before they leave the office. If you're sitting there chatting for an extra 15 minutes or an hour. So for the energy part, it happens. You feel it immediately, and it tends to hold for about 10 days if it's just the energy that you're looking for. If we're repairing issues, like when we're repairing the adrenal, when we're repairing neuropathy with those diabetics with neuropathy that need to have the myelin on the nerves redefined, when we're doing brain repair, often after 3 treatments, they're good for 1 or 2 years.
Wow.
After the treatment. Now, I do tell them there's certain things you need to take orally so you don't have to come back and see me every week to maintain. But once those people with profound deficits, when we fix those profound deficits, there are long-term lasting benefits, like the 5-year-old who was told, parents were told that she was brain damaged and to put her away. 5, 6 pediatric neurologists looked at her, said she didn't have autism, but they didn't know what was wrong, but that she was going to be a burden to the mother. We treated her 7 treatments. It's just a kid who really wasn't walking well, wasn't eating well, was not really communicating well, and they would carry her into daycare in the morning, put her in a cot at 9 o'clock, bring her back come back at 5 o'clock, pick her up at the same cot. And then after 6 treatments, they would pull up to daycare, open the door, and she would run into daycare, rip and run all day long, come back and say, "Hi, Mommy, how you doing?" Made us all cry.
What a blessing. What a nice thing.
It was a beautiful experience. She wasn't perfect, but she was 70% better, and long ways from needing to go to any type of institution. And the mother, who was a mother of 5, was really happy about that. And I haven't seen her for 3-4 years now. Now I know how she's doing because her uncle decided to come to work for me.
Cool.
So he always tells me that that she's still taking the supplements, that she's doing fine. And those people were the most profound cases I tend not to have to treat a lot. Those with diabetic neuropathy, sometimes when we treat them, they're telling me that the pain of the neuropathy is coming back 6 months later, and I have to treat them again. But remember, if you were doing certain things that got you into trouble, like eating wrong, and I treat you and I correct those to get you out of trouble, if you don't change your habits, you can get back in trouble again.
Right.
So my injections don't change your habits. It doesn't change your mindset. We need patients to participate all the way. And some patients, like my patient with liver issues, I tell them, we can improve those liver values with this treatment. Those patients with hepatitis C, those patients who are looking pending liver transplants, who we've treated, particularly with the glutathione and the omegas. And the one person whose name I won't call, but he has a tendency to call the office on Thursdays and says, "Will Dr. Wilcox be on Monday? Let me set an appointment." If they set an appointment on Monday, he continues to go out and drink on the weekends. When I said, "You only have 2 strands of liver left, you can't afford to drink," but he's experienced the treatments correcting his liver problem. I said, sooner or later, our luck's going to run out. We can't keep challenging the liver when your liver's already compromised, when your values are through the roof negatively. And yes, we bring them back with the treatments, but if you continue your bad habits, sooner or later this magic's gonna run out.
Yeah, you can't fight that poison too long, huh?
Yeah, you can't. we need total participation. We need total participation. But if you continue the habits that got you into trouble, even if we get you out of trouble and those habits continue, you get back in trouble again.
Doc, one thing you mentioned earlier a little bit too is like vitamin C and vitamin D. How much do we need?
Well, those people who are fighting the adrenal syndrome, I know we're bouncing back and forth here.
Right.
Those who are fighting adrenal syndrome, they need to be anywhere from 500 to 3,000 milligrams a day of vitamin C. For the adrenal syndrome, they need to be between 900 to 1,500 milligrams a day of vitamin B5. For adrenal syndrome, you need to be around 5,000 units a day of vitamin D3. The darker you are, the more you should take. So our Afro-Americans were taking up to 10,000 units a day. The more fair-skinned you are, the less you need, so 5,000 a day. Many patients who I see are on 200 and 300 and 500 units of vitamin D3 a day, and it's way, way, way too low. You need to be on vitamin D3 at high dosages. Mark Surison, who is the vitamin D guru for the United States, who lives in St. George, Utah, and I know him well because I was personal trainer to his wife. So I would go to the house and train him a few years back, and he would come back from his meetings in Washington D.C. and would be in my ear telling me the new recommendation of vitamin D3. And that's how I learned how off we were in terms of how much vitamin D3 we recommend people will take. You're listening to KLAV 1230 AM. Please call us, KLAV 1230 AM. Call us at 731-1230, 731-1230. Listen to KLAV 1230 AM.
We'll be right back.
Hello, my name is Dr. Simmon Wilcox. I'm a board-certified physician in family medicine. I have 20 years' experience with drug and alcohol abuse and treatment thereof. I bring to you a new service at my facility. We're asking you to examine your household, your family, your community, and decide if there's someone there who needs what we have to offer.
Give Dr. Simmon Wilcox a call today at 702-749-7111. Are you having difficulty detoxing from drugs or medication? Let Dr. Wilcox help you. Call at 702-749-7111. His revolutionary detoxing program is designed to help you detox without the discomfort of other procedures. Call him at 702-749-7111. Visit his office in Summerlin at 8751 Charleston, Suite 210 behind Fleming Steakhouse. Call Dr. Wilcox at 702-749-7111.
Do you know that 60% of the healthcare dollars spent over the next 10 years will be spent on stem cells or a stem cell-related process? Listen in as we define for you how medicine will change your life and the life of those who you love over the next 10 to 15 years.
Covering the issues that matter and adding years to your life. Longevity with Dr. Wilcox. Monday and Thursday morning at 10. Only here on KLAV.
Just about 4 years ago, I was longboarding, hit the side of a truck. I'm sent home with the oxycodone and the Percocet. The dose milligram, it didn't change, but how often I would take them did. I wanted to stop. These withdrawal symptoms are something that I wish upon no one. I went to my doctor, Dr. Wilcox. He claimed withdrawal free. It was literally a miracle. I feel, I would say 100% better.
I'm Dr. Simmon Wilcox. I've been practicing medicine for the last 23 years. My passion has been drug and alcohol dependency, particularly methamphetamine. So what I've done in my practice, I've re-engineered how we approach the detox rejuvenation process. You go through a process where you don't feel any symptoms. My staff's priority is to ensure you're not having that discomfort.
Call 702-749-7111.
You're listening to Longevity with Dr. Wilcox. The phone lines are open at 731-1230. Now, here again, your host, Dr. Wilcox.
We're back. I understand there's a caller on the line, Tim? Hello?
Hello, how you doing?
Yes, I'm Dr. Wilcox here. How are you?
Oh, pretty good. There's a product that the Bulgarian weightlifters used to take. It's called Tribristan.
Tribristan.
Yeah, Tribristan. I don't know if Triplis terrestres is the concentrated form or if that's the concentrated form. But now, if I took regular Triblis, would that help me put some weight back on?
I have to say that I'm not familiar with that exactly. So I have to, I can only speak to what I know. And even though I was a former power lifter, that is not something that I've had experience with. But I would be more than glad if you give us a call to the office tomorrow, that I'll have my research team look at it and give you a more concise answer. But
all right, that'd be great.
Okay.
Okay, thanks, Doc.
Okay, no problem.
Bye-bye.
Thank you. Yeah.
That was interesting.
Yeah, that was interesting. Very good. You had a question there, JR.
Well, Doc, how many IV treatments really does it take to get what we need?
The average person needs 3. Even with Tiffany, we're going to be able to modify a number of things for her. I recently looked at her blood work. She has not given me permission to talk about her blood work, so I won't. But I recently looked at her blood work, and we're going to make some adjustments for her that's going to reduce her need to drive from all the way from where is it, Tehachapi?
Tehachapi.
To drive from Tehachapi here to Vegas. I think she probably would, at that point, need me once every 6 months or so. But the IVs give you the quick start, and once I'm able to get a handle on your history and your blood work, then I can make some decisions that put you in a position where you don't need to see me. Now, that's not always to my benefit, but I rather heal you, let you walk away, and send me 5 other patients because we've done a good job with what we've been doing.
Yeah, we hate money. We don't like money, do we? We do this just because we love people. Love people, hate money.
Well,
money is a tool.
We got to pay the rent, though.
Yeah, we do.
We got to pay the rent. Last week, and I mentioned on the radio show, and you was not here, and I congratulated I think Centennial Toyota.
Yeah.
For donating the car and that car went to I guess it was given away, or in a free raffle, in a
hole in one
polo.
Yeah, hole in one
contest. Hole in one contest.
Yeah.
Keep me straight. And I guess it was about children who've been victimized.
Yeah, it's Missing and Exploited Children. It's a really good charity. It's John Walsh of America's Most Wanted, and most everybody out there probably knows his story. But this is his charity, Missing and Exploited Children. And Canon does a real nice job as well. They're their main sponsor. It's a first class. I look forward to it every year because of the touching stories more than anything else. Of course, they do have a nice banquet at the Bellagio and a nice golf tournament, which is fun, which we have the opportunity to meet Kevin Sorbo and met a couple other celebrities who are going to come see us. I was surprised that the Hollywood people that are maybe in our age range, in their 50s, they didn't really know much about intravenous nutrition. And when I started talking, I was talking to Kevin Sorbo, and then
who's Hercules?
Hercules. He was Hercules for 7 years. Yeah, he told me a little history about the show. The show actually ran at its second year, beat out Baywatch. So we know those girls were out there looking at Hercules. You know why the boys are looking at the girls on the beach. But Kevin actually came in Saturday morning. We made a special appointment for him to come in and get treated. And
he did, and the girls at the office went crazy.
Oh, they're all giggling. Do you need a medical assistant?
They ignored me and you. And Kevin got all the attention. I felt so small. But, it is what it is. He was a great guy.
He's humble, beautiful man, very nice man. And
he's given us permission to share his experience there at the office, so we're not violating any patient confidentiality.
Not at all.
He said we can use his name, and he's going to help promote us.
And him and I are a lot in common, Doc.
Really,
about the medical systems and hospitals.
I thought you were going to tell me you had similar bodies.
Well, that's in my mind. I have that body. I got to vision it before I can get it, but it's on its way.
Okay, that's right.
Okay,
that's right.
But he had his father. His folks live here in town, and his father went in for a procedure in a hospital. He's 87 years old, and he came home with more than he expected. Came home with a staph infection.
Oh. Okay.
Nothing they can do for him. Unfortunately, they had to watch. He said I had to watch my father dwindle away, and so he and I are kind of on the same regimen there. I don't want to speak for him, put words in his mouth, but we talked about this, and he had a medical issue as well. Kevin is he's a devout Christian, and he's doing some Christian movies right now. It's real exciting. Went on Book of Revelations. He's in Texas right now filming that, but. He also, I say he's a Christian because I want to elaborate into this story that he shared, that he had a lump somewhere right here on his shoulder, and he was in his chiropractor's office. And he's been there 8 years and never allowed him to crack his neck. Mm-hmm. He allowed the guy. He said he heard a voice in his head said, "Don't let him crack your neck." And he goes to his chiropractor, says, "Did you say something?" And he goes, "No, I didn't hear nothing. I didn't say nothing." So he puts his face back down. Table. Here's a voice says, "Don't let him crack your neck." And he goes, "What'd you say?"
Really?
And his chiropractor said, "I didn't say nothing." So he knew what that little small voice was inside his head. However, unfortunately, cracked his neck. And when they cracked that neck, it agitated that lump and sent some blood clots into down through his arm, and he had a stroke.
Yeah.
And this is common knowledge because he wrote a book called True Strength. He had to learn how to walk again. I mean, they kept it pretty quiet and under wraps in Hollywood for quite a while, but then he wanted to tell the story. So he's very into the nutrition game. He did a lot of nutrition. And then I spoke with him after we treated him the next day. And he said he's feeling better, not as sluggish, and is excited to coming back in. He's going to pass this way here through next week to a charity event.
Great guy. He looks good.
He looks
really
great.
Looks good. You would never think that he ever had a stroke at all.
He doesn't beat himself up, and there's no signs of a stroke whatsoever on him. Zero.
No residual deficit that I'm able to identify as a physician. He's functioning well. He's still making movies. Let me just hone in on the issue of his strokes, and he did have. I think the clots led to 3 strokes.
Yeah.
And he's had tremendous and powerful recovery from that. He's back full force doing what he loves to do. If you look at the University of Colorado, they released a paper maybe 7 years ago now that says every single person with a stroke should essentially receive intravenous omegas. They also said that every diabetic, particularly diabetics with diabetic neuropathy, should receive the omegas. And they were probably the first university that I'm aware of in the United States that endorsed this format of treatment for various diseases, particularly for stroke patients and for those who've had diabetes. And they said the papers suggested you have it immediately, although we are finding ourselves treating people who are 3, 4, 5, 6 years out, like Kevin, and they're still gaining improvement even on the backside. And part of the problem, as I tell people all the time, is that whenever you have a stroke, let's say it's the size of a quarter, in your mind you think that a stroke means that tissue where the stroke was involved in, that tissue is all dead. And the reality is that 70% of that tissue is actually just sleeping, is dormant. It's not dead. And there's certain things you can do to wake it up. One of those things is a hyperbaric chamber, which I endorse a lot. We don't have one, but I endorse that. And then when we're not able to make it to hyperbaric chamber, the next best thing is the intravenous omegas and the glutathione treatments that we give that to help wake that area up so that it becomes much more functional. Patricia King, Kane, is the one who initially trained me on this almost 17 years ago, and she was saying those 2 injections are able to resolve 50% of the neurological diseases out here. She's a brilliant biochemist, MD, out of Philadelphia, and she's just begun to be recognized by the Ivory Towers for the quality of her work and her brilliance in realizing that these 2 injections, which are relatively expensive when you look at all the other treatments that are out there, and the phenomenal job they do in terms of brain repair, in terms of neurological repair that we experience with that.
What I just got to ask you, and for maybe our listeners, Ivory Towers. What elaborate on that a little bit?
Ivory Towers.
She's gotten noticed by the Ivory Towers, but
Ivory Towers. Basically, I jokingly refer to Ivory Towers. Those who are the big universities, the Harvards of the world, the Johns Hopkins of the world, the big universities, because they usually will set the pace for what the standard of care should be. But the reality is there's a lot of care that's available that the Ivory Towers have yet to endorse, and often they're cutting edge items on the table, and it may take the Ivory Towers 7, 8, 9, 10 years to catch up to the fact that they are worthwhile endorsing. Part of it has to do with the mentality of those who are in the Ivory Towers. They tend to be older and maybe not as progressive. And then also Ivory Towers want to make sure they don't have any undue liability. Therefore, they want to wait to see all the double-blind studies come in, and those studies can take 5, 6, 7, 8, 9, 10 years. But there are clients out there who can't wait 7, 8, 9, 10 years, who, if there's something that's relatively safe, you often talk to your doctor, and yourself will agree or disagree to proceed with that particular item as an option. So that's the Ivory Towers. The Ivory Towers are the big brothers who usually who dictate policy, dictate what should happen in medicine, but they're not necessarily on the cutting edge. They often are 10 years behind, and people will say by the time that information reaches a book, it's already 7 or 8 years old. So you need to be at the conferences, hearing the lectures, reading the papers that are fresh. But the information now is doubling so fast that by the time the paper is printed out, there's often new information coming right behind it. Then by the time it reaches a book format, you're easily 6, 7 years behind in terms of what's transpiring. So medicine's really fascinating. It's moving fast. Lots of new innovations, and the omegas and the glutathione is among that. And as I told the other client who we saw a number on Saturday, but one of the ones we saw on Saturday who had been on chronic pain medicine, that pain medicine not only reduces your testosterone, as I've said before on the show, it also reduces your glutathione. And you need your body's glutathione if you're going to have any type of quality of life. You're listening to KLAV 1230 AM, KLAV 1230 AM. Please call us at 731-1230, 731-1230.
We'll be right back.
Just about 4 years ago, I was longboarding, hit the side of a truck. I'm sent home with the oxycodone and the Percocet. The dose milligram, it didn't change, but how often I would take them did. I wanted to stop. These withdrawal symptoms are something that I wish upon no one. I went to my doctor, Dr. Wilcox. He claimed withdrawal free. It was literally a miracle. I feel, I would say 100% better.
I'm Dr. Simmon Wilcox. I've been practicing medicine for the last 23 years. My passion has been drug and alcohol dependency, particularly methamphetamine. So what I've done in my practice, I've re-engineered how we approach the detox rejuvenation process. You go through a process where you don't feel any symptoms. My staff's priority is to ensure you're not having that discomfort.
Call 702-749-7111.
Do you know that 60% of the healthcare dollars spent over the next 10 years will be spent on stem cells or a stem cell related process? Listen in as we define for you how medicine will change your life and the life of those who you love over the next 10 to 15 years.
Covering the issues that matter and adding years to your life. Longevity with Dr. Wilcox. Monday and Thursday morning at 10. Only here on KLAV.
Are you having difficulty detoxing from drugs or medication? Let Dr. Wilcox help you. Call at 702-749-7111. His revolutionary detoxing program is designed to help you detox without the discomfort of other procedures. Call him at 702-749-7111. Visit his office in Summerlin at 8751 Charleston, Suite 210 behind Fleming Steakhouse. Call Dr. Wilcox at 702-749-7111.
Hello, my name is Dr. Simmon Wilcox. I'm a board-certified physician in family medicine. I have 20 years' experience with drug and alcohol abuse and treatment thereof. I bring to you a new service at my facility. We're asking you to examine your household, your family, your community, and decide if there's someone there who needs what we have to offer.
Give Dr. Simmon Wilcox a call today at 702-749-7111.
Today is the first day of the rest of your life. This is Longevity with Dr. Wilcox.
JL, you had another question there.
Yeah, Doc. I know that what we've done so far, because I've done some of the treatments, I take my vitamin D3, and I'm taking 5,000 milligrams, and it's amazing to me that 5,000 milligrams, it fits in a small little capsule.
Exactly.
I was shocked how small it was. And then vitamin C, I've been doing my C as well, but I know the effect of taking it intravenously. I know what I have. I know I'm getting it. So can I do the C and the D3 as well in an injection?
It can be, and we offer the vitamin C IV as part of the vitamin therapy. That's an option. Obviously, it's more expensive than buying it over the shelf, but at least when you get it IV, you got it. Some people like to come in for what they call their vitamin tune-up. They want all their vitamins IV once every 4 months. Insurance doesn't cover that, but they like to come in and have that done, and we're more than glad to oblige. You can get vitamin D3 in injectable format, and we can give it injectable. Usually it's actually IM that we give it in form of calciferol, and it does a phenomenal job when you give it IM for anybody with skin disorders, really? Chronic rashes, and it along with the omegas, do a tremendous improvement in the skin tone. I think Tiffany spoke to that when she called in about the quality of her skin, and most people will tell me that their skin looks 5 to 10 years younger within a week or so of getting the omegas. So it goes in. Now remember, every cell has a membrane. The outer layer of every cell is made up of the omegas. So all these cells in your skin, they all got membrane. So what we really did was we went in with the injectable omegas and we revitalized all those cells. And that's why you see this tremendous improvement in the glow on someone's face, and the quality of their skin, and what looks like a reversal in the aging process. shortly after receiving the Omegas IV and the glutathione.
Cool. Two things, Doc. You say I am, and I think I know what it means. Is that intermuscular?
Thank you for
And the dog talk.
Making me clarify. Yeah, that's intramuscular. That's an IM injection that just goes directly into the muscle as opposed to intravenously, which is into the vein.
Okay.
We typically will give the calciferol IM, which is intramuscular, as opposed to IV. It's just the way it's designed. It's more syrupy, like, and it's not designed to be given IV.
Okay.
So we can give that, and we can give the vitamin C's. We can give iron even, IV for those people with low iron and can't get enough of the iron. We give the iron IV. So most of the things out there, we can give you either IV, most of them IV, and if not, we can give it intramuscular. If there's any issues with absorption, our friend Sherry, who I called last week, had issues with absorption, so she gets everything from us, IV or IM. Again, Sherry doesn't mind me telling her story. So all that's a possibility. Let me just say one other thing about the adrenals before we close out the show today. That the adrenals are critical for something called DHEA.
Okay.
You know, we've all heard about that. Many of us have went to the health food store to buy DHEA. But the adrenals actually is where the DHEA is made. And so that's another issue in terms of, and one of the things we put back onto the table when we're trying to resolve your adrenal issues, along with the need to give you magnesium, because magnesium is important for those mineral cortisols that's made in the adrenals. And we have a caller on the line. I think the name was Ralph. Ralph, are you there?
Yes.
How are you doing this morning, Ralph?
I'm doing well, Doctor. I wanted to know if you're familiar with this Mind Over Medicine. It's the title of her book. She's a doctor, and she's written several books, and she's making a statement that the vast majority of what is prescribed by doctors is really unnecessary. And I didn't know if you had heard anything about this. I'll just let you answer.
I've actually have heard a lot about it. There's a lot of validity to what they say in the book. The problem is that in medicine, in medical training, and I'll give you the short answer since we're running out of time. We don't train in medicine to look at the psychosocial piece that's presenting as disease. We go straight to the disease and learn how to fix it. But many people who present to the doctor's offices are presenting, like we talked about a little earlier in the show, with issues relative to their stress, their inability to sleep, their anxiety, their inability to gain weight, their reduced sex drive, their lightheadedness, their craving for sugars, the intensity of their pain, particularly in the upper back and the neck, the difficulty in getting up in the morning, the lightheadedness. A lot of the things we chase in medicine with prescriptions can be traced back to stressful event and lifestyle issues. So she's absolutely correct. There are a lot of lifestyle issues, but part of the problem is getting the patients to buy into that. The patients often come to the doctor's office and they press for the prescription, even though the real answer is we need a lifestyle change. And you know, we're Americans and we like the quick fix. But yes, thank you for that call. Thank you for that inquiry. I would urge everyone to pick up the book and take a review and begin to understand what changes you can make in your lifestyle to reduce your need on prescription.
I'll give us a call later at the office too, since we're running out of time, if you would like to go discuss it a little further as well.
Absolutely. Thank you for calling, Ralph.
Thank you, Ralph.
Thank you for listening to KLAV 1230 AM. KLAV 1230 AM. We'll be back on Thursday from 10 to 11. Have a great day.
So.